In this podcast episode, physician and addiction expert Dr. Gabor Maté delves into the intricate connections between childhood experiences, ADHD, addiction, autoimmune diseases, and trauma. His insights challenge conventional views on these issues, emphasizing the profound impact of early life conditions on mental and physical health. Dr. Maté begins by defining childhood conditions, which encompass both physical and emotional environments. He explains that a child's development is significantly influenced by factors such as nutrition, housing, and emotional support. The emotional landscape, including a child's sense of being accepted and understood, plays a crucial role in shaping their personality and brain development. Stressors such as parental conflict, economic hardship, and trauma can create an unstable environment that adversely affects a child's growth. He emphasizes that these early experiences are not merely background noise. They are foundational to how a child's brain develops. The interplay between a child's environment and their genetic predispositions can lead to various outcomes, including ADHD. Dr. Maté argues that understanding these conditions is essential for addressing the challenges faced by children, particularly those from marginalized backgrounds. Dr. Maté asserts that ADHD is often mischaracterized as a purely genetic disorder. While genetic predispositions may exist, he argues that the environment plays a pivotal role in whether these predispositions manifest. He points out that children exposed to stress during pregnancy or those raised in poverty are more likely to be diagnosed with ADHD. This perspective shifts the focus from a purely biological understanding to one that considers the broader context of a child's life. He shares his personal experience of being diagnosed with ADHD later in life, which led him to reflect on the impact of his childhood environment. Dr. Maté highlights that ADHD is not a fixed condition, but rather a response to adverse experiences. By recognizing the role of trauma and stress in the development of ADHD, we can better understand the behaviors associated with it and work towards more effective interventions. A significant aspect of Dr. Maté's discussion revolves around dopamine, a neurotransmitter crucial for motivation and focus. He explains that ADHD medications often work by increasing dopamine levels in the brain. However, he emphasizes that the development of dopamine receptors is influenced by environmental factors, particularly during early childhood. Stressful conditions can lead to a decrease in dopamine receptors, which in turn affects a child's ability to focus and regulate impulses. Dr. Maté draws parallels between ADHD and addiction, noting that both conditions involve challenges with impulse control and the regulation of dopamine. He argues that individuals with ADHD may turn to substances or behaviors that artificially boost dopamine levels as a coping mechanism. This connection underscores the importance of addressing the underlying environmental factors that contribute to both ADHD and addiction. Dr. Maté's insights into addiction are particularly compelling. He defines addiction not as a disease, but as a response to emotional pain and trauma. He encourages listeners to ask not why someone is addicted, but why they are in pain. This reframing shifts the focus from individual blame to understanding the broader context of a person's life experiences. He shares his experiences working with individuals struggling with addiction, particularly in Vancouver's downtown east side, where he observed a high prevalence of undiagnosed ADHD among his patients. Dr. Maté emphasizes that addiction often serves as a coping mechanism for unresolved emotional pain, and understanding this connection is crucial for effective treatment. By addressing the root causes of pain, rather than merely treating the symptoms of addiction, we can foster healing and recovery. Dr. Maté highlights the unique challenges faced by women, particularly in relation to autoimmune diseases. He notes that women are disproportionately affected by these conditions, often due to societal expectations that compel them to prioritize others' needs over their own. This tendency to suppress their own emotions and desires can lead to chronic stress, which in turn undermines their immune system. He explains that many women internalize the belief that they must be nice and accommodating, often at the expense of their own well-being. This pattern of behavior can manifest in various ways, including autoimmune disorders, where the immune system begins to attack the body it is meant to protect. Dr. Mate's insights shed light on the societal pressures that contribute to these health issues, emphasizing the need for women to reclaim their authenticity and prioritize their own needs. Dr. Maté discusses the physiological mechanisms linking stress to autoimmune diseases. He explains that chronic stress can lead to dysregulation of the immune system, causing it to turn against the body. This connection is particularly relevant for women, who often face unique stressors related to societal expectations and caregiving roles. He emphasizes that understanding the emotional roots of autoimmune diseases is essential for effective treatment. By addressing the underlying stressors and emotional patterns that contribute to these conditions, individuals can begin to heal. Dr. Maté encourages listeners to explore their own emotional landscapes and recognize the impact of their experiences on their physical health. A recurring theme in Dr. Maté's discussion is the importance of emotional awareness and authenticity. He argues that many individuals, particularly women, struggle to express their emotions due to societal conditioning. This repression can lead to a range of health issues, including ADHD and autoimmune diseases. Dr. Maté encourages listeners to cultivate a deeper understanding of their emotions and to recognize the needs that drive their behaviors. By validating their feelings and learning to express them in healthy ways, individuals can begin to break free from the patterns that contribute to their suffering. This process of self-discovery is essential for healing and personal growth. Dr. Maté emphasizes that healing is not solely an individual process, it is also a communal one. He highlights the importance of social support and connection in overcoming trauma and addiction. Community plays a vital role in providing the emotional resources necessary for healing, and individuals are more likely to thrive when they feel supported and understood. He discusses the value of group therapy and support networks, such as 12-step programs, in fostering connection and accountability. While he acknowledges that these programs may have limitations, he believes that the sense of belonging and shared experience they provide is invaluable. Dr. Maté encourages listeners to seek out supportive communities that can help them navigate their healing journeys. Dr. Maté also touches on the healing power of nature, emphasizing its role in promoting emotional well-being. He suggests that spending time in natural environments can have a profound impact on mental health, helping individuals reconnect with themselves and their emotions. Nature offers a space for reflection and rejuvenation, allowing individuals to step away from the stresses of daily life. He encourages listeners to explore the outdoors and engage with their surroundings as a means of fostering healing. Whether through hiking, gardening, or simply spending time in a park, connecting with nature can provide a sense of peace and grounding that is essential for emotional health. As the conversation progresses, Dr. Maté offers practical steps for individuals seeking to heal from trauma, ADHD, or addiction. He emphasizes the importance of self-compassion and understanding, encouraging listeners to approach their experiences with kindness rather than judgment. By recognizing that their struggles are rooted in their life experiences, individuals can begin to shift their perspectives and foster healing. He also highlights the significance of mindfulness and meditation as tools for cultivating emotional awareness. These practices can help individuals develop a deeper connection to their thoughts and feelings, allowing them to navigate their emotional landscapes with greater ease. Dr. Maté encourages listeners to explore various techniques that resonate with them, emphasizing that healing is a personal journey.